Video 13, we will continue with phase 2. So phase 2 is started in the year 1999 to 2004. So phase 2 of the National AIDS Control Program has become effective in 1999. It is a 100% centrally sponsored scheme implemented in 32 states, union territories and 3 municipal corporations, namely Ahmedabad, Chennai and Mumbai, through AIDS control societies. So this scheme has been implemented in 32 states and union territories and 3 municipal corporations, namely Ahmedabad, Chennai and Mumbai, during AIDS control societies. Okay, so we will see what are the objectives of this phase 2. So to shift the focus from raising awareness to changing behavior through interventions, particularly for groups at high risk of contracting and spreading HIV. So they brought in the awareness, okay, through interventions, particularly for groups who are at high risk, okay, of contracting and spreading HIV. Next, we see that to support decentralization of service delivery. So we know what is decentralization. From the central government, all the resources, supplies to be given to the state or the district hospital. Okay, to support decentralization of service delivery to the state and municipalities, and a new facilitating role for National AIDS Control Organization. Program delivery would be flexible, evidence-based, participatory, and to rely on local program implementation plan. Okay, so they made sure all the sources, okay, all the requirement, okay, that is being decentralized, okay, of service from the central government to the state and municipalities. And then they also made sure that a new facilitating role for National AIDS Control Organization was provided, and all this delivery should be flexible, evidence-based, participatory, and rely on local program implementation. So according to the program, whatever was the requirement of the sources that had to be given. Okay, so it is also made sure that people should participate in it, evidence-based, actually whether they are doing it or not. So based on this, decentralization of the services was done. Next, to prevent human rights by encouraging voluntary counseling and testing and discouraging mandatory testing. So making sure that human rights has to be protected. So voluntarily we can counsel them, so we can ask them, because the cases were more found among the drivers, lorry drivers. Okay, so they are all at high risk, and even they have their family. Again, the family members of these truck drivers can also become at high risk, okay, which can happen because of the sexual contact. So making sure and providing counseling. If anybody is doubting themselves, then asking them to undergo testing. But then if they are not willing, if they are not into any kind of high risk, then it is not mandatory that the person has to undergo testing. Next, we see that to support structured and evidence-based annual reviews and ongoing operational research. So they'll make sure that there will be a research that will be done, how much of the resources has been met, how much of the counseling sessions has been done, how much of the improvement have been done. Based on that, they will make sure that there is an ongoing operational research and evidence-based. So based on the research, they'll find out, as I told you, in all these, and they will try how much it has been progressed. Next, to encourage management reforms such as better managed state level AIDS control societies and improved drug and equipment procurement practices. These reforms are proposed with a view to bring about a sense of ownership of the program among the states, municipal corporations, NGOs and other implementing agencies. So making sure that that all this AIDS control program has been well organized or managed in the particular states or the societies, okay, and they cope up with the management reforms, and then they see that the drug and the equipment that is required for testing, everything has been provided, the practices have been carried out properly, and then they also see that if these reforms are being proposed with a view to bring sense of ownership, so each state should take up that responsibility, assessing whether all the state, municipal corporation, NGOs, whether they are implementing and whether they are taking up the ownership. So these are all the various components of phase 2. And phase 2, we know that it started in the year 1999 to 2004. Now we will see what were the strategies of phase 2. So talking about the strategies of phase 2, so we will see how, first strategy we see the delivery of cost effective interventions against HIV and AIDS. So making sure that whatever treatment will be provided, it is cost effective, which can be affordable by the people. Okay, then strengthen capacity in property targeted intervention for group at risk, prevention intervention for the general community. So making sure that priority targeted, so all the intervention has to be given to the high risk group, and also making sure to the general community we have to provide the prevention methods. So how do we do that? IEC, that is through the information education, communication and awareness campaigns, conducting health education through mass media, then providing voluntary testing and counseling, reduce transmission by blood transfusion and occupational exposure. So occupational exposure means, which is mainly for the nurses or the lab technician, or to the doctors who are working when they are using pricking needles, okay, for the patient, being careful with the needle stick injuries. And then low cost AIDS care, so again making it affordable for the infected patients. Thirdly, institutional strengthenings, so building implementation capacity at states and municipal level, so making sure that well spacious infrastructure is being provided in the hospital. Strengthening leadership capacity of NACO, okay, that is National AIDS Control Program, making sure that they do hire capable leaders. Then expand and improve national wide sexually transmitted infection, and then you have HIV AIDS sentinel surveillance, so close observation on these three, okay. And then training the professionals, then we see build capacity for monitoring and evaluation program activities. Then we have increased India's capacity for research on HIV AIDS, so research is how well the services that is being provided is reaching the patient, or how well medications that is given to the patients is actually enhancing good health in the patient. So research on various aspects. So these 4 points all includes these are all the various strategies under phase 2. Next we will go into phase 3, which started in the year 2007 to 2012. So here it is based on the experience and lessons drawn from NAC. So usually from the phase 1, phase 2, whatever they have studied about the strength and weakness, to work on that, phase 3 was started. So objectives, when we see, to prevent infection through saturation of coverage of high risk groups with targeted intervention and scaled up interventions in the general population. So in the general population, their main target was on the high risk population, to find out, to target them and to give the care. Then to provide greater care, support and treatment to more people living with HIV or AIDS. So giving great care and support to the treatment people who are receiving them. So psychological support, giving, meeting the financial needs and providing adequate care. Okay, and then to strengthen the infrastructure, systems and human resources and prevention, care, support and treatment program at district, state and national levels. So making sure that it is being, all this care has been concentrated in state level, district level and national levels. To strengthen the nationwide strategic information management system, the specific goal of this phase to reverse and stabilize the spread of AIDS by reducing the rate of incidence by 60% in high prevalent states and by 40% in vulnerable states. So making sure that the reduction of the rate of the AIDS, okay, has to come down, and the incidence, that is the new cases, okay, of 60% in high prevalent area, it has to come down, and by 40% in vulnerable states where people are prone to get, okay. So these are all the various objectives of phase 3. Next we will see strategies of phase 3. So what are the main strategies? So here, considering that more than 99% of the population in the country is free from infection, NACP third places the highest priority on preventive efforts. So here also we see that their main motive was to prevent, and then subpopulation that have the highest risk of exposure to HIV will receive the highest priority in intervention. Okay, already we have seen like people who are at high risk, such as sex workers, men who have sex with men, and injection drug users. Okay, so all these were at higher risk, so identifying them and giving care. Then in general population, those who have the greater need for accessing prevention services such as treatment of STI, voluntary counseling, testing, condoms will be next in the line of priority. So after identification, also giving general population, we have to assess what are the preventive services that they are taking, then how to treat sexually transmitted diseases or infections, and then voluntary counseling and using testing them and asking them to use condoms. Okay, so this is the next line of priority. Then NACP third phase ensures that all person who need treatment would have access to prophylaxis and management of opportunistic infections. So people who need treatment, they made sure that prophylactic treatment was given to them, and like whatever like source of infection had to be ruled out, and accordingly they were treated. And then prevention needs of children are addressed through universal provision of PPT CT services. So making sure that children are also addressed through universal provision of PPT CT services. So even for the children the services were given because they were also prone to develop, as we know it is from the mother's womb it is transmitted to the babies and they develop this. So making sure that all kind of facilities are given to the children worldwide. Okay, so giving them prophylactic treatment. Okay, making sure that prophylactic treatment is given to them, and then they will make sure that if they have already been affected, then prophylactic they can treat the children. So usually at 18 months of delivery they will be able to find out if the child is infected with HIV or not, making sure that all the needs of the medical treatment is also given to the children. Then you have NACP third phase is committed to address the needs of persons infected and affected by HIV, especially children. So here in third phase we also see that they are starting focusing on the children. Then NACP third phase also plans to invest in community health center to provide psychological support, outreach services, referral and palliative care. What is palliative care? Just treating when they are at the risk of death. We know that no more, they're totally immunosuppressed. So what they do is only symptomatic treatment will be given to the patient, that is called as palliative care. The NACP third work with other agencies. So they also work with other agencies in order to reduce, such as women's group, youth group, trade union, etc., to integrate HIV prevention into their activities. So these are the various strategies of phase 3. Next we will move on to phase 4, so which is during 2012 to 2017. So here we see that Cabinet Committee on Economic Affairs chaired by the Prime Minister has given its approval for continuation of National AIDS Control Program 4 beyond 12th 5-year plan for a period of 3 years from April 2017 to March 2020. So we have made sure, okay, so this 5-year plan, this one has been started during, that is a fourth phase has been started during April 2017 to March 2020. So what is the goal? So accelerate reversal and integrate response. So you have to reverse back the AIDS, okay, rate. Then objectives to reduce new infections. So new cases has to be reduced by 50%, and then to provide comprehensive care and support to all the people. To give a total care, people who are infected with HIV, AIDS and treatment services who all require it. Next, key strategies. So what are the strategies we will see? Strategy 1, intensifying and consolidating prevention services with a focus on HRGS and vulnerable population. So when we say HRGS, high risk group. So identifying the high risk group and then providing the services, care. The next strategy, increasing access and promoting comprehensive care, support and treatment. When identified, they are made sure that they are providing comprehensive health care and support is being provided. Then strategy 3, expanding information, education, communication services for the general population, high risk group with a focus on behavioral change and demand generation. So making sure that providing health education through various mass media, so that among the general population as well as the high risk, in order to prevent the so high risk people already, if they have been exposed, then they have to make sure that they come for the checking, testing, and then we'll have to see if they're infected or not. And then building, strategy 4, building capacities at national level, state, district and facility level, same like third. Okay, so making sure that all these are implemented at state level, district level and national level. Then 5, strategy 5, strengthening state information management system. So making sure that all the information management system are being strengthened by providing adequate resources, manpower. Okay. So last we will go to guiding principles of NACP fourth phase. So continued emphasis on 3 ones. 1, agreed action framework. 1, national HIV AIDS coordinating authority, and 1, agreed national MNE system. So providing equity according to the gender, respect for the rights of people who are affected with HIV. Okay, so providing all this, these are all the principles, like equal rights should be given, then gender equally they have to be treated. Then we have to respect the patients who are already living with HIV infection. Then we have to continue, like 3 emphasizes should be done: 1 agreed action framework, 1 national HIV coordinating authority, and 1 agreed national M&E system. So making sure that all the resources are available for the patients, and then civic society representation and participation, improve public-private partnership. So they can also have, public like government, organizations can have, relations with the public sectors in order to give good health care, decentralization, and then evidence-based and result program implementation. So making sure if one particular program for HIV patients has been started, which has become effective, then making sure that, this can be used for the benefit of the patients. Okay, so we will see what are the key priorities under NACP 4. So preventing new infection, that we have seen already. Then prevention of parent to child transmission. Okay, so that is very important. So that is what PPCT. Okay, so here PPTCT services, prevention from parent to child, okay, transmission. So making sure that, if already it has been transferred, then treatment has to be given. Okay, and then focusing on IEC strategies, health education on high risk group, and demand generation. It is all repeated points. And providing comprehensive care, supportive care to eligible patients living with HIV. Then reducing stigma and discrimination to greater involvement of person living with HIV. Then decentralization of services. Then ensuring effective use of strategic information level of programs is given in all areas. Then building capacities of NGO and civic society partners, especially in states with emerging epidemics. Then integrating HIV services giving, and then mainstreaming HIV activities key in all the areas like central state departments, which should be given higher priority, and resources of the respective departments will be leveraged. Social protection and insurance mechanism for people living HIV should be strengthened. So all the areas of people living with HIV should be given, mainly, focusing on the treatment, cost effective. In all the other district, it has to be, concentrated, and then the department should be strengthened in order to give good care. Then we also talk about PPTCT, that is prevention from parent transmission to the child. So making sure that is done, and then adequate treatment to the children is given. Okay, then decentralization, comprehensive care, reducing stigma. Okay, telling them, so people are scared, so teaching them the right way. IEC plays a vital role here. So these are all the main key points which we have studied under NACP 4th phase. So next we will move on to National Strategic Plan 2017 to 24. So when we see here, ensure a more effective, sustained and comprehensive coverage of AIDS services. NACO, that is National AIDS Control Organization, or has implemented a 7-year. So they have implemented a 7-year program here, that is from 17 to 24, which is the current one. Okay, so the National Strategic Plan NSP will herald the country to the midpoint of the 2030 goals. So next 7 years, and their critical investment may now result in substantial ending of AIDS. So making sure that by 2030, this AIDS should be ended. Then vision, when we talk about the vision of this program is to paving the way for an AIDS-free India. So looking for a AIDS-free India through attaining universal coverage of HIV, prevention, treatment. So it has to be prevented, treatment should be given for effectively, so that there is no existing cases, inclusive, equitable and adaptive to needs. Next goal, when we see, it is 3 zeros: the zero infection, zero AIDS related deaths, and zero discrimination, which form the basis of the strategic plan. 3-0, they say that no new cases should be found and no death should happen, zero death because of this infection, and then zero discrimination. There is no discrimination, whether it is for a baby or for an adult or for male, female, high society, low society, doesn't vary. They have to be treated equally. Okay, so these are all the basis of the strategic plan. Then by 2020, the focus of the national program will be achieving the following fast track target. Now talking about the target, HIV, 75% reduction in new HIV infection should be there. Then 90% of those who are HIV positive should know their status, and 90% of those who know their status are on treatment. So knowing the status is whether When a person get to know that he is infected, then he should know that there is a need for treatment, and 90% of those who are on treatment experience effective viral load suppression. So who are already effective. So we see that 90 of the country should know their status, and 90% should know their status and undergo treatment. People who are under treatment, they should have their virus suppressed. And you have the other target is elimination of mother to child transmission. Okay, PP, from parent to child transmission should not be there, and syphilis. Then elimination of stigma and discrimination. So we should remove the stigma. Okay, so they also require love, care, not pushing them away from the family. So this has to be rectified mainly through IEC, information, education, communication. Okay, so with this we have done with our national AIDS control program. So under that we have seen introduction, what is the burden of disease, then what are the prevention methods, then we have seen phases, so first phase, second phase, third phase, fourth phase. Under that we have seen what are their components, what are their strategies, aims and goals. Okay, then we have seen after the 4 phases national strategic plan. Okay, that is by 2030 it should be free India, and what are their vision, goal, targets. Okay, we'll continue, we'll see the next program in the next video.